Hey there, this is Andy Slawetsky from Industry Analysts. I am here today by Tuan Tran, president of printing and imaging over at HP. How are you today, Tuan? Thanks for joining me.
Thanks for having me, Andy. I'm doing great, doing great. I mean, all circumstances considering, yes, very good.
Things considered, right? So that's my first question, which is health-wise, how's everybody doing on your end, your family, your friends, your community out there in Vancouver, Washington? How are the HP employees doing? How's everyone faring?
Yeah, I think in again, circumstances taken into account, I think everything's going very well. Certainly my family and I think great. We're in lockdown mode, so all the kids are at home. We're spending time in quarantine, really focused on just staying away from people, social isolation, to try to do our part to contain the spread of the virus. I think in regards to the HP team, obviously lots of adjustments in terms of working style, behavior. We've actually sent our employees very early on to work at home wherever it's possible. We also run a very big organization, so the situation changes and is very different depending where you are in the world, right? So if you think about our employees in China who are really on lockdown, probably
Weeks
6,
ago.
8, 10 weeks ago. I think they're back in the office. Factories are up running, people back to the office. Our employees in South Korea, again, seems to have a handle on it. They're in a flattened part of the curve, as I guess the new technical term. Our employees in Japan, I think, they were there and they're good shape. In the U.S., Spain, very, very challenging situation, as you know, with what's happening in Spain and Italy and Europe. And then the U.S., I think, is an emerging crisis, I think, given the curves that we're seeing. So I think that's depending where you are in the world, this affects you, but clearly, no matter where you are in the world, this affects you. Right? So.
Absolutely. So just a quick question on supply chain. Everything's still moving along. It sounds like the stuff you have over in China is going to start catching back up. Not that now that we're slowed down, they might not need to catch up so quickly. Same with Korea. How are you managing a global operation? Most of my interviews have been a lot of U.S.-based companies, and it's a little easier to manage. But you guys are in a different situation. There's countries that are, like you mentioned, further ahead of us. Some countries that are behind us on the curve, and you're going to have to adjust for that and deal with that. Some of your manufacturing is literally all over the place. So how are you coordinating and then communicating with your staff personally, your team, the people we met at the meeting I was just at in Palo Alto a couple months ago? Now that everybody's moved to home, you guys are a collaboration, a data company. So how's the shift gone, and what kind of your own technologies have been helpful in managing all of this, and what have you learned from it?
Yeah, let me try to answer the first part of your question. The first part is really around global supply chain, and undoubtedly there's when the coronavirus first hit, or COVID-19 first hit, it was isolated to China, Wuhan district. We had manufacturing facilities there, and lots of people put in a lot of work managing kind of how do you actually manage through a supply shortage around the world, manage your weeks of supply, manage the shipment, manage the low-level components. So really just trying to balance out and keep the current operations running. That was really kind of work that we did early on, probably January, February timeframe, in terms of managing expectations for what the supply chain was. And for us, I think, and we went out pretty publicly, and we said, hey, it's going to have an impact. It's not that big of an impact, right, in terms of the supply chain. I think what you're seeing now is more of a demand side impact, right? As you think about this becoming a pandemic, this becoming a situation where a large swath of the knowledge workers now are work at home. Now, for us at HP, to answer the second part of your question, really, I think we're learning how to work at home. I mean, HP is a company that is international, global by nature, and so we're used to this virtual work. But this is one of those situations where it's generally a group of people working and then other people dialing in. This now is everybody working from home, and it poses, I think, interesting challenges, but also interesting opportunities, right? I think for us, the use of technology, especially around, when I'm talking to you now, the PC that Alex sent me, actually, it works great. It's got fantastic video. It's got fantastic audio, great mics. I don't have to actually have a little headset on. So I'm like, I'm loving this thing. And having the phone conferences or now video conferences with everyone, I think is a new way of working. I mean, we've had Enrique staff, the ELT, is meeting now 3 times a week, all on video. And it's actually quite productive. It's amazing how productive it is, because you can see everyone, and you can read the expressions, but you can also we probably see more of each other now on video than we normally see in real life, and that holds true of my direct staff and my senior leadership team. In fact, I had a senior leadership team of about all my directors and VPs, 250, 300 people on the line all at once. And it was cool because I could actually go through and look at everybody's faces, people I hadn't seen for a while. And I was calling out names and asking how they were doing. And it's just, it helps when you have that.
It is cool. And, I have to say, as somebody who really never liked to do video conferences at all, I just didn't, I'm not going to say it's mostly because I didn't want to clean up my background office here behind me, but I just wasn't comfortable doing it. And this sort of forces you, outside your comfort zone. And next thing you know, I thought, well, these interviews would be kind of interesting.
Right.
So next thing you know, you've got a new way to work, a new technology that you're relying on that you never really thought that you would use. So,
right. We had a all hands coffee talk. We usually all hands meetings. We had like almost 3,000 people on the line.
That's amazing.
Right? And then we had my staff actually all on video. Wow. And lots of very positive responses from that.
It's cool. I'm going to continue using this going forward. I hated it before just because I wasn't comfortable using it, but now, it's really not, maybe it's part of the fact that, I haven't been on an airplane and visited people in so long, and I'm really sort of just jonesing for that human contact, right? That we're all, not getting anymore. So it's nice to see another face and talk to somebody. So
that's the downside of working, at home too, is that you miss that human interaction, right? So
yeah.
That's important. So we try to reach out actually to our employees even more than we have in the past, is really making sure that interaction is there, because sometimes you also could feel like you're very, very isolated, right? So
yeah. So HP, obviously, you're heavily relied on in fighting this virus in ways that we all really would readily think of, right? So, printing, you're a massive supplier of printer, the biggest probably, I would say, in the world, right? So your printers, your inkjets, your lasers, they're in hospitals, they're in frontline responders, they're in They're everywhere. Your PCs, your laptops, all that stuff, your technology is, so that's obvious to me. What I want to talk about are some of the things that we saw during that visit that I alluded to in Palo Alto that people may not think of HP as being involved with, at least the people in my channel, people who follow me, which are the 2 specific areas that I was just kind of blown away with when I saw it. And now, now that I'm thinking about what's going on in this world, you're probably a lot more closer to the front line than people would think of. Can you talk about 3D? Can you talk a little, and then we'll talk about the bioprinters as well.
Yeah, so I mean, I think this is one of those times where people really pull together, right? This is a time where we all come together. We all try to do what we can do to help our communities and help others in need. And as I think the 3D team has been a great example of leading that charge for HP. Right now, with the 3D technology, you have the ability to print things on demand, and as we all know, there are many things there that as this the number of people are affected by a virus, it really overwhelms our healthcare system, right? And a lot of the things around, I'll give you some examples, right? Mask holders, right? An adjustment, those are 3D printed. Things like, when you open a door, now that you don't want to get infection, so 3D door handles, right? Ventilators, and as you think about ventilator parts, really the caps on a ventilator, air flows, and actually regulating that. I think there was all sorts of crazy idea. There was a snorkel mask with the snorkels mask things in front. They're using that as a makeshift mask because they're short supply, and so people are printing the top part that allows you to breathe. And so that's a 3D part that's under development. And we're working with a company to actually get the specs for that and then sharing that online so that people can use those types of, that's not in short supply, whereas your facial mask, the disposable ones, are in very short supply, right? So those types of applications are actually coming out of the woodwork. We're dealing with, we have an organization within 3D, a team within 3D, vetting and working through, vetting those specifications, making them public, and working with the health officials in the affected countries to get those approved. And in fact, because of this situation we happen to have a very large 3D presence in Spain. And in Spain, Spain, as you know, is one of the epicenters of the virus. I think they overtook China as in terms of number of deaths. And so today, and so lots of work in Spain with Spanish employees and the health system there to actually get some of these parts in production. Also, manufacturing and printing them up, real time. So just incredible amount of work, incredible demonstration of, the things we can all do to support our community.
So it's just awesome to hear that, you've got this technology that's been used in manufacturing, you're trying to make a name for yourself, and then all of a sudden, this pandemic hits, and now you're shifting all this energy, all these efforts into, fighting for the cause, printing these masks, printing these parts for the masks, and parts for, just the ventilators, all the stuff that you mentioned. It's just, it's heartwarming to hear stories like this, right? Where it's not just about business as usual, it's sort of the bigger picture and the greater cause. That other product that I saw, those, I have to look at the bioprinter. I'm a hard copy.
300E bioprinter. Yeah.
That was all smart stuff. You showed us fellows and you had all these scientists, and that was fascinating to me. I have to tell you, probably a lot of it was over my head. But I did understand the basics of it, which was this is to help the medical industry with testing. Why don't you go from there?
Yeah, I mean, we have it, as we shared with you, our SPS organization takes our core inkjet technology and really adapts it to certain vertical industries. One of the industries that really deals with fluid is drugs, right? Drug interaction and drug dispensing. And so if you think about a drug dispenser, it's really about, shooting precise amounts of liquid onto a surface. And that surface, we do that in, large scale with inkjet cartridges on paper. Now think about drug interaction is basically, vaccine doses into a small container so that you can control and understand and be very precise about the amount of fluid you're putting into a little test tube. And so what we've done is we've built a printer that has a cartridge full of little test tubes. And so you can basically, put this, the way this printer works is you put it into this cartridge into the printer. It has rows and columns of little test tubes. And then it uses a print head to actually dispense very, very precise amounts of drugs into these test tubes. And then you can take that and then you can actually go through a clinical trial, or you can go through the next level of testing, right, in terms of what you want to do in terms of controlled doses. And that is really what the process is to create a vaccine, right? You have to think about the amount of, virus that you want to put into a test tube, and then to go through the testing required to actually develop vaccines. So you saw a note from Enrique where we're actually deploying that to CDC, working with CDC, actually enabling as many machines as they need for them to do the testing they need in order to accelerate the effort for both a treatment as well as a vaccine for COVID. So we're, again, a small example of doing our part in terms of what we can do to help the community.
And I think I saw, correct me if I'm wrong, but an article I just posted to my website in the last couple of days. You guys are sending those out. You're just sending them free to places of need. You're sending the cartridges free.
Right.
We'll make money down the road, but right now you're really just pitching in and doing, I would say, more than your part. And we all greatly appreciate that. But I will actually put a link to that video. Vanessa mentioned that there is a video that you guys have that I can share. I'll put that in this layout for this article, for this interview as well, so people can see that that technology in place. But it's amazing stuff that you do. And I, that was a real eye opener at that meeting that we had where you walked us through some of the labs and just seeing the scientists and the things they were working on cancer. And I look at you as a printer company, right? Because that's how I interact with you. But, seeing these fellows there and hearing the kinds of things they were working on are any of your scientists dedicating any time towards this virus specifically, or is it really just focusing on what we do to help those people work on the virus?
What we do to help those people. We don't have domain expertise in terms of vaccines or treatment, right? We have domain expertise on microfluidics, right? Being able to actually dispense small amounts very precisely of fluids onto cartridges, and I think that really is our small part in terms of helping the coronavirus and trying to find a treatment here.
Well, I mean, I thought of that when I was talking about setting this up. I thought that technology has got to be helping people right now. I know it is.
Sure, so. Absolutely. The world's bonded together in terms of finding a cure, right? We're all in this together. That's one thing about the situation we're in, is that you realize, man, we're all connected. We're all interrelated.
We are.
It's like something happens in China, it's going to spread. It's a small world.
We're all going to help each other, bring each other down, right?
Yeah. It's even if you think about the coronavirus as what we're all being asked to do, right? We're all being asked to do our part, and our part is to stay home, really, make sure that we don't do our part in spreading the virus. And it's one of those situations where we all have a very specific role to play. And for us, for HP, I think it's about the safety of our employees and really making sure we're focused on protecting our employees both in the work environment, in our offices, but also, in client sites. We have a lot of businesses where we have employees going into the front line. Hospitals, as you mentioned, right? A lot of our printers are in hospitals. They require servicing. A lot of our PSPs are working on specific things for packaging and signage. We have, working with the community, as we talked about, and then really doing our part in terms of trying to do what we can to advance the treatment and cure. So.
Well, this is awesome. And I do want to follow up with you maybe in a couple of weeks or in a month or so and see what the progress has been like, where you're at that point. Maybe then we'll spend a little more time talking about more specifics on the channel and what you're doing there. But, I know you have a lot to do, and I appreciate the time that you've already given me. So thanks so much. Is there one last thing you'd like to share? One last thing you'd like to say out there while you're here?
No, I think again, just as HP employees, I think for us, we're focused right now on really protecting the health and safety of our employees and meeting our customer needs. And the good news is I think we're seeing a tremendous amount of demand on the business side with PCs and printers and work at home. That whole technology, I think the technology helps bridge the gap between, working in the office and collaborating while you're remote. And I think we have fortunately, with all the business activities we have with PCs and home printers, actually, that's gotten quite a good spike. So.
I bet it has. That's definitely a conversation, probably a really good segment for another chat, because you must have done okay with that. But we'll talk about that another time.
All right. Thanks, Andy.
Thanks so much, Tuan. I really appreciate it, and you be safe. And thank you, HP, for all that you guys have been doing for us. So,
right. Thanks, Andy. Take care. Bye-bye.
Bye-bye.